very concerned about the health care bill as it's proposed in the House right now. I think that some of the ideas that you laid forth as a regular proposal, the health savings account expansion, I think is a great idea. Tax credits, individual tax coverage. I think are things that we can agree on. Tort reform would be a major part of any bill because that is one of the reasons. I'm not convinced that going across state lines will save money that has been suggested for several reasons, because healthcare delivery system is different in those areas. I know they keep talking about Pennsylvania being so low, but it's because the hospital facilities, the healthcare delivery system is so much less than. So people from New York start buying policies in Pennsylvania, it's going to become more expensive. We'll also lose the state regulation and state control, and one only has to look at what happened with M-Plan, and the state of Indiana have to take that plan over in the last 2 years. As you know, I'm opposed to a national insurance SAR, which has been proposed. But I think that there are other things that you can do. When they look at going across state lines, one of the issues is you're going to be dealing with the same insurance companies. WellPoint, Anthem, and United Healthcare are the two giants out there. And the federal government has allowed them to merge throughout the country, and they are number 1 and number 2, and they are so large that the third and fourth size company will never catch either one of them. And so they have great economies of scale and have lowered their costs, which has led to record profits for them. I'm in the insurance industry, so I'm not opposed to profit. But I think that the economies of scales that they have achieved because of these mergers are not being passed on to the consumer. And when you go across state lines, you're just going to be dealing, for the most part, with the same carriers.
Okay, all right. Don't try to get my attention. You guys controlling the mics, we'll do this. With regard to, I want to respond and then we'll go to the next question. One of the things that we had to do as the President moved into this national debate was I thought it was important to debunk the 45 to 47 million, quote, uninsured in the country. Because he's using that number constantly to almost guilt us in, and last week called this a moral question for the country. Okay? So let's kind of do this. Of the 47 million, what we've learned by also outside groups studying this is that around 23% of the 45 to 47 million are already eligible for health insurance but have not yet enrolled in the safety net programs like Medicaid or SCHIP. 22% have incomes over 300% of the federal poverty level but have chosen not to purchase health insurance. Individual choice. There are anywhere between 9.3 million and 12 million individuals of whom are not U.S. citizens. They're here in an alien status, either legal or illegal. And my Democrat colleagues include them in this guilt and shame that they're trying to do upon America. The 60% of that number of the uninsured are individuals under the age of 35. The true target of the uninsured population of individuals who are citizens, low income, and do not qualify for other federal assistance is around 10 million. So if we really want to go after this particular number, I look at this and say, let's not throw out the baby with the bathwater, okay? There's a present health system here in which we can make some strong incremental improvements in. And we can go after this number if that, in fact, is the President's goal. And one in particular, when you look at the strong number who are under the age of 35, I mean, think about yourself. When you were 18 and in your 20s, you got to live forever. I'm going to buy a Trans Am. I don't know. I mean, you're going to go out and do something instead of spending the money on health care, right? And those are the kind of choices that are being made. But why are they making that choice? Because we don't have tax fairness. There's not tax equity. So businesses out there, you get a tax deduction with regard to the purchase of health insurance for your employees. But if you're an individual, you don't get the tax deduction. And so if we say, okay, Steve, what do you want to do? And I've had this conversation with some of my Democrat colleagues. One in particular said, I don't want to do a public option. I said, okay, what do you want? And we're both colonels. He's a retired colonel, and I'm still in the Army Reserves, and I thought I'd do the military thing. And so I said, okay, what do you want? And he goes, I want to cover catastrophic. And I said, done. We can do that. I want to do medical liability reform. And he said, okay. And I said, well, then let's take care of the tax equity issues. More people. And he said, okay, I can do that. And all of a sudden we started talking, and it's like, well, how come we can't do this to help the country? And that's what we should be doing in Congress, are doing these types of things. So whether it's creating the risk pools through associated health plans, the discussion about if you want to bring competition in the marketplace and purchasing across state lines, we can discuss and debate that as an issue. The Med-Mal reform and the catastrophic and the pre-existing condition, that's one heck of a health bill, you know? And so the president is looking for ground, bipartisan ground, okay? Bipartisan ground. There it is. I just laid it out. But I just haven't been invited to the White House, you know? And so the president also made this comment about that he wants a bipartisan bill, okay? I'm going to debunk this for you, a bipartisan bill. I offered a wellness amendment, The president's been out there talking about wellness programs, all right? I agree with that, Mr. President. When I offered the wellness amendment, I turned to a colleague of mine from Michigan, who has the upper peninsula of Michigan, Bart Stupak, and asked him to co-sponsor the bill with me of a bipartisan amendment to increase wellness programs. There are companies out there that if you come in for cholesterol screening, diabetes prevention, all kinds of different things, you can lessen the premium. Well, I think that's a pretty good thing. Personal responsibility. When the White House heard what I had done, they contacted Bart Stupak and told him to get off the bill. So when they got off that amendment, and I offered the amendment before the committee, the Democrats defeated the amendment. So my only comment publicly now, and message to the president, is if you're going to say under the American people that you want a bipartisan bill, where is your good faith?